Okay, so here we have a normal heart's anatomy. So to name a few structures, this is the aorta. This is the pulmonary artery. Also called the PA for short. We have the lungs over here. Not pictured, but all the way over there. We have the pulmonary veins. Here and here and over here. And then this is the right atrium and the right ventricle. Here's the left atrium and the left ventricle. And then this is the inferior vena cava and superior vena cava. So when we're talking about normal blood flow, the IVC and the SVC bring blood from the body to the heart. So blood comes from the lower part of your body without oxygen and the upper part of your body without oxygen because you've used it all. And then all of that blood that needs oxygen will come right into the right atrium. So from here, blood is pumped from the right atrium to the right ventricle. And then from the right ventricle, all of the blood is pumped out the pulmonary artery and it goes into the lungs. So all of this blood goes to the lungs. In the lungs, it picks up the oxygen when you breathe in and out. We are inhaling and exhaling oxygen and carbon dioxide, so it picks everything we need up, and then it returns from the lungs to the heart through the pulmonary veins. They bring the blood from here to the lungs and into the left atrium. And then the blood goes from the left atrium to the left ventricle. And then the blood is pumped from the left ventricle out to the body. And there you have it. So in newborn babies, they have what's called a PDA, or a patent ductus arteriosus. And this connects the aorta to the pulmonary artery. And this allows for blood to go between the two arteries while they're in the womb, because babies don't really use their lungs until after birth. This stays open for a few hours to a few days after a baby's born, and then it will close on its own and they no longer need it. So here's a view of the outside of a normal heart. So you have the aorta right here, branching off to give blood to the body, and you have the pulmonary artery right here that branches off to give blood to the lungs. Then the blood comes back to the pulmonary veins right here to go back to the heart. So I'm showing you this view because you can see the coronary arteries. They're right here in red. And what these do is they give blood to the heart. So while the heart gives blood to everywhere else, the coronaries deliver blood to all of the muscles that allow the heart to pump blood. One thing that they're going to do in her surgery is they are going to what's called re-implant the coronaries. So right now, they are currently connected to the side of her body that's going to the lungs. So when they flip her pulmonary artery and aorta to make them on the normal side, the coronaries will be on the pulmonary side. And that means that if we don't switch them, all of this blood that's going to go to the heart would be blue, or unoxygenated blood. So they'll have to cut little buttons out, which I'll show you a better view on the picture of the inside of the heart. But they'll cut little buttons to move the tips of these coronaries and sew them into the new aorta. And that way, just like in a normal heart, every time the heart squeezes, oxygenated blood is being delivered to the heart. If any of these become obstructed, or what we call ischemic, which means no blood flow is going past a certain point, that's what causes a heart attack. So that's one of the potential complications in a arterial switch. So Addie has what's called detransposition of the great arteries with a ventricular septal defect, or D-TGA with a VSD. So her anatomy is different from a normal heart because the aorta and the pulmonary artery are flipped. They're backwards. So this means that blood without oxygen is being pumped to her body, and blood with oxygen is being pumped to the lungs in these like separate loops. So we'll walk through that with some color. So blood comes from the body and then into the right atrium. And then it's pumped from the right atrium to the right ventricle. And then that blood is pumped to the body. And then in a separate loop, blood from the lungs is coming back with oxygen, going to the left atrium, then going to the left ventricle, and then going right back to the lungs to pick up more oxygen. Now this is a problem because in this current state, Addie's body is not getting enough oxygen for adequate oxygen levels. A normal person will sit oxygen above 95%. You and I are probably at 98, 99%. When Addie's born with this heart anatomy, she could sit anywhere from 75 to like low 90s. And we can talk a little bit about why that's such a wide range. But all the babies, like we mentioned earlier, have what's called the patent ductus arteriosus, or PDA. This is really important in Addie's anatomy because blood from the aorta that doesn't have any oxygen has the ability to cross over and then go into the lungs to pick up oxygen. Another point of mixing blood that she'll have is through what's called a PFO, or a small hole in the atriums between the left and right atrium. It's sometimes present at birth and can close on its own. We won't know the size of it until she's born. But that also allows for blood from the left side of the heart to come to the right side to mix, and then from the right side to the left side to mix. And then what's specific to her anatomy, some kids with D-TGA have it and some don't, is this VSD, which is this hole right here between the ventricles. So that really allows for blood to mix, and it gets a little messy. But because now she has all of these mixing points, she can get more oxygen going to her body than she normally would. And then the blood going to the lungs will also be mixed. So because of all of these mixing points, her oxygen will be 75 to 90%. It's a pretty wide range. We just want greater than 75% before her surgery. So one thing that's going to happen immediately after she's born is she will get an IV placed, and they will start her on a medicine called prostaglandins, or PGE for short. And what this medicine does is it forces her PDA to stay open, because it will want to close on its own, like every newborn baby will have it close on its own, but we don't want it to close until she goes and gets her surgery. So that medicine will force this to stay open so she can have this mixing point and get more oxygen to her body. I also want to point out the coronaries right here. So in my previous picture of the outside of the heart's anatomy, we know that the coronary arteries go down the heart and supply the heart muscles with blood. In a normal person, they get oxygenated blood straight from the lungs. They'll get the fresh oxygen. In Addie's anatomy, in this current state, her coronaries, which are attached to her aorta, would be getting blue blood or mixed blood. And that's not great in the long run. We would like her to have the fully oxygenated blood. So I'm putting this out here because when I talk about her surgery and how they're going to correct her anatomy, these are a big role. So to correct Addie's anatomy, the surgeons are going to perform what's called an arterial switch. And this means pretty much just flipping her great arteries back to the normal side of the heart that they're supposed to be on. Sounds simple in theory, right? But so what they have to do is, because you cannot take the root of these out. Think of like the root of your hair. This is where it connects to your head, and then this is your actual hair. We're going to cut the hair instead of pulling out the hair. So they have to keep these two bases where they are. So they're going to cut here and here and disconnect the aorta from the aortic root and the pulmonary artery from the pulmonary root. So we'll just put that back, and then they're going to pull the aorta over to connect to the left side of the heart where it's supposed to be, and then they're going to pull the pulmonary artery over and reconnect it to the right side of the heart where it's supposed to be. And then they're going to take a little piece of her pericardium, which is the outside muscles of her heart that she has extra of, it's like this extra layer, and they're going to use it to patch up her VSD and close this hole. And then they will, if she has a big hole up here, they'll close that as well. And then they'll just let the PDA close on its own. So one of the potential complications in an arterial switch, there's only two main ones that are associated with this. When they pull the pulmonary artery over to reattach it here, sometimes these get really tiny. So as she gets older, if they become too tiny, they might have to go in and open them up a little bit. The other complication is with the coronaries. So remember, the coronaries are attached to the aortic root. But after we have switched, this is now her neo-aorta, or new aorta. So if we leave the coronaries on this side of the heart, only blue blood, or the blood without oxygen, is going to be given to the heart. And we need fully oxygenated blood to be given back to the heart muscles. So they have to take, because these will go outside of the heart and they'll connect. They have to take these coronaries and move them over here. So this is going to be called re-implanting the coronaries. But because these veins are so tiny, think the whole heart of her size is going to be about the size of a quarter. So you can only imagine how tiny these are. They can't just cut them straight and re-sew them in from the base. They have to take a portion of the vessel around the arteries like a button. So they cut a circle around the coronaries. So the coronaries are attached to this big chunk of tissue here. So then they can take this big chunk of tissue, or what's called a coronary button, and they just sew the buttons back onto the neo-aorta. So then those would not be there anymore. One complication with this is that sometimes these can get obstructed and cause a lack of blood flow to go to the heart. And like I said in our video of the outside anatomy, when these coronary arteries can't give blood to the heart, that can trigger what we know as a heart attack, or coronary ischemia. So that's one of the complications that they are going to monitor after her surgery, and make sure that it all goes well. So now her surgery is complete. Her blood flow will be back to a normal state. So we have the unoxygenated blood from the body coming to the right atrium, going to the right ventricle, and then going to the lungs to pick up more blood. And then we have blood coming back from the lungs and going to the left atrium, where it goes to the left ventricle, out to the coronaries, and to the rest of the body. And they've fixed it.